Hello you guys, welcome to a new vlog. So we are starting off with my CT scan results and I kind of want to go through how I found out. I woke up.
I have to say, she is looking huge. Like, I'm not trying to be mean, but she is taking up the whole screen. She doesn't look like she's lost much weight. I still stand by the fact. I think there's no way, even just looking at her upper body, that she's 485, 490 pounds. I still think she's closer, and I'm being generous. I think she's closer to like 540. I mean, she's really looking big. And wow, it's okay.
Up today with no call from my doctor, and I do have like this portal thing going through the imaging center that I went to get the CT scan.
Well, Amber, they have other patients besides you. I know these girls like to think that the world revolves around them, but it doesn't.
They said that the results might be on there even before my doctor calls me, so
yeah,
I was like,
because it's all attached to your like social security number and patient number. So yeah, a lot of the times it's plugged in before they actually get a chance to call you, because many doctors, Amber, they have a designated time of day where they sit and do their recording and their phone calls, because during the day they have other patients that have appointments that have to be seen, and they don't look and see, oh my God, Amberlynn Reed's test came back. I have to stop everything I'm doing to let her know. No, they don't do that. Whether it's good, bad, or the what, they will get a hold of you during their time frame that they have to make phone calls.
Like I woke up and
it's usually not first thing in the day, or it's usually after hours.
Like, let me check that. Well, I saw the results and I got to see the results of like each one of my organs. It showed that I have a hernia, which I've known that. I actually got it from getting a full hysterectomy, a 21-inch incision. So yeah, they said that that might happen to me, and it did. So I knew I had that, but that was in the results. And then something else I knew that I had is I have a benign tumor on my adrenal gland.
She's never mentioned this. Has she mentioned this before? I've watched a lot of Amberlynn stuff, despite only being like really in her world for a couple of years. I don't remember her mentioning that.
Which is actually pretty common. I've known about
it. Can be common and benign. You can have little benign tumors and cysts and things like that. Obviously it's something they should check to make sure it is like not a problem, but yeah.
This for years, so I knew that. But the big thing that I was looking for was, what does it say about my bladder? Because I was very scared that a cancer did come back, and I was scared that it came in the form of bladder cancer.
Well, Amber, you wouldn't have to worry so much if you would have actually done what they told you to do after your surgery. If you would have went for your follow-ups, and yes, a CT scan is okay. Yes, an MRI is okay. It's even better. But the gold standard test they wanted you to get to definitively really confirm at that time all the cancer was gone was a PET scan. And that was the biggest reason they wanted you to lose weight, that you needed to lose weight, was to get that PET scan. Because that would have given them the best results possible, and you never did that. So, and you never went to your follow-ups. I don't care what you say, there's just no way, because you're too lazy to actually make a phone call once every 6 months and then get driven, get up and sit in a car and get driven to an appointment and then come home. So you're kind of reaping what you sow right now, girl.
That is what I have been just like dying about on the inside, for the lack of a better term. Just constant anxiety and intrusive thoughts and just like tons of fear. But there's nothing on my bladder. There's nothing in my bladder.
Dissociate, intrusive thoughts. Girl's been watching mental health TikTok.
The results said I have a remarkable, as they call it, remarkable bladder. That's just like the technical term they use. So,
and I saw that she posted, she meant to say unremarkable. I honestly think she said, looked it up and saw that remarkable meant something was wrong and unremarkable meant nothing. I think she said remarkable on purpose to get engagement and get people talking. Because if you looked in her comments, there was like 300, 500 extra comments of people all saying the same thing. You meant unremarkable. Remarkable means like it was the same thing. So I honestly, when she saw that, she looked it up. So I think she said that on purpose just to get engagement.
So I literally was worrying for nothing. So then I kept going through and I was like,
you're not worrying for nothing though, Amber. You don't have a problem now, but you have probably an enlarged heart, an enlarged liver, super fatty liver, fat around your heart, fat around your kidneys, around, tons of visceral fat, excess fat, inflammation, joint damage, probably coronary artery disease to a large degree. Problems with your blood and lymph flow, obviously. Look at what's going on with your legs. You don't have a reason to sit back and relax and go, whew, everything's okay. But you know what? Because it didn't come back with cancer, that's what she's going to do. She's going to say, oh, I was fine. Everything was good. I just had a test, guys. I'm 100% cancer free. Everything's good. And it's going to 100% be an excuse for her to not have to make big changes that she, in fact, needs to make. And it's going to be, I suspected this, but it's just more infuriating than ever. Like I said, these girls just keep getting chance after frickin' chance after chance, and they squander it. And it's like, then whenever she finally does start having big problems and runs out of chances, she's going to cry and, oh my God, I can't believe this is happening. And I'm so scared and blah, 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 and have pity on me and pray for me. Like, no.
Okay, well, it has to be something. Well, so it turns out that I have a 6 millimeter kidney stone in my kidney. It's non-obstructable. And then I immediately Googled it.
Unobstructive? Okay.
And it says that you can have blood in your urine from having this. And I was like, oh my God. And just instantly, I just felt so...
You need to drink more water, Amber. I just want to know, how much junk are you drinking? Because I have drank a ton of diet soda and stuff like that. And there was a time I drank a ton of soda and like little water, like a few years back. I didn't drink a lot of water at all. And I've never in my life had a kidney stone. Didn't even suspect it. So like, and I know some people are more prone to them, but is she like mainlining diet soda?
So relieved. And I was like, okay, I'm going to call my doctor because I'm reading these results. I see them. I know how to comprehend them. But I would like my doctor to...
Get out of here, Amber. That's so insulting. You're reading these results. You know how to comprehend them. Amber, I'm surprised you can say the word comprehend. You can't even say the word hungry. I'm not just going to start slinging insults. No, you comprehended them because you read what they said and then you went on to Dr. Google and looked it up, and some Google explanation told you what they were. And then what? You're going to call your doctor and say, like, look, are you going to double check with him to make sure what he is saying is right compared to what you read on like Wikipedia or something?
Talk to me about them. So when I called, the nurse said that my doctor didn't see anything on there to be alarmed about and everything looked fine.
Yeah, Amber, haven't you heard the phrase no news is good news? Like if a doctor is not rushing to call you, then it's usually pretty good at all.
And that I should still go to the urologist. But I mentioned to the nurse that it does say that I have a 6 millimeter kidney stone.
They're going to tell you to drink water, cranberry juice or something and let it pass. And then if you still have symptoms over the course of the next few weeks, like go back, you know what I mean? But she's gonna see, everything was good, all it is a kidney stone. She's not gonna follow up with a urologist. She's not gonna follow up with a kidney doctor or a cancer doctor or even this PCP. She's just too lazy. She is just the lazy in these girls. It is just a level I can't even comprehend. Imagine being too lazy to go to a doctor when you don't have to go, you don't have to drive, you get literally chauffeured around by a family member. All you have to do is show up. And that, okay.
And I was wondering, like, is that what is causing my symptoms? So she's like, oh, okay, hold on, I'll ask him. She went and asked him, and he said that, yeah, that's probably
that
what is
and
causing
being
it.
like having like 400 some extra pounds on your body will also cause pain and discomfort. And look at this like look on her face. She like looks and acts like yeah, she's telling us something. Oh, I just
Still see the
I need a little I need like some venting from Amber.
neurologist, especially because that kidney stone is kind of big. I'm not gonna lie. I don't know what they're gonna want me to do with that. But the issue is,
Well, what are they gonna do, Amber? What do you expect them to do? What if it was like so big and it was really big, or there was a bunch of them and it was causing problems or getting stuck in some sort of a duct? What can they do? They can't open you up and do surgery unless it was like literally life-threatening, because putting you under is more of a risk than, you know what I mean? Like, what do you expect them to do? They're freaking doctors. They're amazing. They aren't Gandalf. They can't like create magic and miracles.
I called, and since I'm a new patient, appointment isn't until November, so that's pretty far.
Serves you right, Amber. You know, you knew where you were moving. You knew when you were moving. All you cared about was trying to like get a new girlfriend or try to get Feline Jade back, and drink and eat the house down because nobody was there to stop you when you moved there. And you didn't take not even an hour out of those first few months to look up some doctors and get a new patient packet and become a new patient. So you are having to deal with what the rest of us plebs apparently you think we are. You're dealing with what we have to deal with, Amber, because apparently these doctors don't know that you're clean and that they have to rearrange everything for you. And I love that for you.
Or from now. So I don't know if like I should like ask to be referred to somewhere else that could see me sooner, or like
Amber, no. When I was working at the doctor and you called to set up a new patient appointment, I said, okay, we don't have one till November, ma'am. And you said, well, oh my gosh, like that's too far away for me because, you know, I'm super important and I'm more important than everybody else. Can you call somewhere else or refer me to somewhere else? No, that's not how it works. They don't refer you to anything because you're not in their system. You're not a patient. It's not a specialist. I would say, and they would say, well, there's some really good other doctors, you know, and depending on your insurance, which I don't believe she has any, they could like throw you the names of a couple doctors in the area or just say, no, you can call around. They're not going to do that for you, Amber, because again, you're just trying to pass off the responsibility and work to somebody else. You do nothing all day. Look up some freaking doctors and call them. That's your responsibility. Keep the appointment for November and then call some other PCPs and say, look, I'm this irresponsible, like lazy person who should have had a doctor, but I didn't get one. I'm trying to set up a new patient visit to become a patient with your practice. The ones I called, they have nothing till November. Can you see me sooner? Are you accepting new patient? And they will say yes or no. And then if they say yes, and you decide to take that, you get the new patient packet, fill it out, make the appointment, then you call the other place and say, hey, you know what? I did find a doctor who can get me in sooner, so I'm not going to need that appointment. Can you cancel it so they can give it to somebody else? That's all you need to freaking do, Amber. Do your own shit.
What I should do. I'm kind of like in a conflicting area right now, but ultimately I just
No, you're not in a conflicting area at all. You didn't find a doctor, so now you have to go through the hassle of finding a doctor and trying to find one that can get you in before freaking holidays.
Stupid for feeling so scared that something worse was wrong with me. Like,
you weren't that scared, Amber. You really weren't that scared. I'll tell you why. Starbucks, Trader Joe's snacks, frozen meals, mac and cheese. Should I go on? If you were truly scared, those things wouldn't have existed in your life since this all started.
the kidney stone isn't a good thing, but it's very common. I've had them before, and it's much much better than the alternative. I just feel bad because I have worried a lot of you. A lot of you have reached out to me and been so sweet.
I can't believe a lot of people actually still believe this shit. Like, we know what's going on, and it's like, yeah, there are people that still really care about her and worry about her. She's still got those babies. Even though I'm not fond of her, I still ultimately, I don't wish that sort of thing on her. But this woman, like, does this all the time. And here, she really, really clickbaited cancer this time. And what she's going to notice is she's not going to be able to pull this stunt again. Maybe one more time for some of those babies. But people aren't going to fall for it. She didn't get an uptick in views really because of this. People were like, whatever, Amber, you don't help yourself, so why should we care? Next time she does something like this or has a scare, she can't clickbait it and drag it out like this, because people are going to go, nope, especially if she doesn't actually make any meaningful, visible changes to her lifestyle. If we don't see her actually eating healthy, sticking to semaglutide, or trying to get in for weight loss surgery, if we don't see her actively losing legitimate, noticeable weight, not this like 10, 15, 20 pound fluctuation, never proves it. If this happens again and she's not down 100, 120, 150 pounds and still actively losing and eating healthier and making the right choices when she goes to the store or to a restaurant, and she's not walking and trying to move, people are going to have no sympathy for her because they have very little left. This stunt worked this time. It's not going to work again.
And so kind and so supportive, and it like makes me emotional, and I just appreciate so many of you. You guys have no idea, like,
you appreciate the clicks and the views, Amber, because you need money,
the good vibes and thoughts. And I know that I don't believe in God, as I am agnostic, but so many of you have prayed for me.
And you know, you shouldn't ask people to pray for you, Amber, because you look down and make fun of like God and prayer and religion. And I know not everybody that watches believes in God or whatever. I personally do, you know, but it's like, you're rude enough to sit there and tell people after they've lost a parent, oh, nothing happens when you die. There's no heaven. There's no afterlife. You just die and you're gone. You know, just so rudely. So why should anybody pray for you when you know, part of prayer and having a God is that God wants you to take pride in yourself and do for yourself too the best you can. Prayers are like extra, you know, help and support. You do nothing. You just want to sit around and expect the universe to do everything for you while you sit there to continue to not move a muscle, eat, and become one with your couch. So, you know what I mean? And personally, I mean, there is definitive fact that energy cannot be destroyed. It just takes a different form. That's part of my belief. And plus, I've had experiences. I know that there is more after this life. You know, you take on a definitive form. There's been studies that say like they've actually determined the potential weight of a human soul. It's just like crazy stuff. And you don't know how much is actually real or speculation or whatever. But the fact is whatever happens in the next life, if I were Amber and Foodie and that, I'd be horrified. Because Amber, she's done nothing meaningful, contributed nothing, and is not good to people around her. I don't know what she's done in this life to warrant a super good whatever's after this, because she's literally like a walking, breathing depiction of damn near all of the 7 deadly sins. And whether you believe in religion or not, she is still a walking, breathing depiction of almost all of the 7 deadly sins.
And in my opinion, that's just another version of sending out positive thoughts. So all the positive thoughts, all the positive vibes I have.
Amber, that doesn't, and also she, like, do you not agree? She's one of the most snide, smug, manipulative, negative people there are. She's negative. She's arrogant. She's snooty. She's mean. She is just a negative vibe in her own right.
I've felt them so much recently, and I just appreciate you guys so much. And I really hope that it is just this massive kidney stone that is causing these issues. And from the looks of it, it is.
But what are you going to do when it's not, Amber? What are you going to do when it's not something so easily brushed off or treated? Because it's going to get to a point where one day it's not something this simple. Like, it's coming. She's like, oh, I think doom is coming. Doom is a coming. It really is. And then what's she gonna do? Whenever she can't just, like, when it's something just mundane and pretty standard procedure. And I think she almost thinks like it's too good, like she's too good. It's like it's not gonna happen to her. It's gonna be a rude wake-up call when it is.
I'm just really glad that I've chosen to quit smoking. I have chosen to drink nothing.
Amber, I don't think you were smoking all that much. You played up all this stuff so that you could go, look at me. Look at how strong and amazing I am. Look at all these vices I had that I quit. You can't get on me about the food because I've quit all this other stuff. So I've been doing the work. When really the truth is, her only real vice, her only real drug and addiction is food. And she's using and making these other things seem worse. One, to make herself seem more successful and strong and have willpower and to get praise. But two, it's also to deflect that she isn't changing anything about her actual problem, which is food.
Nothing but water. Yeah, I had a small icy at the movie.
Amber, that icy wasn't small. That wasn't small. And I don't believe you're all of a sudden, like, suddenly she's just only drinking water and eating healthy and that. No, Amber, you know why? Because that's hard for people with self-control to do. And you have no self-control and no desire to deprive yourself. We have your history. We know you. We know you're drinking more than that. If you were serious, you wouldn't have gotten the icy because that was worse for you than the diet frickin' soda.
Theater, like recently, like over a week ago, but it's like, I'm not going to be perfect, but like, I no longer drink.
And there she go. There's her excuse. She always uses this, things don't change overnight. It's hard. It takes time. I'm not going to be perfect. I'm going to make mistakes. She always gives herself an out instead of saying, I'm going to do this and I'm just going to say no. And if I have to cry and be mad, I'm going to, but I'm not going to do it. She should strive to be as perfect as she can be, because this woman uses I'm not perfect as an excuse to give in all the time. Like, it would be different if she only did it once a month and she could go a few weeks before she starts messing up, but she can't. So she doesn't have room to be, she needs to not allow herself these things.
Soda, and I am making better changes to my life every single day. And wow.
Really? I don't think you are, because Amber, dude, I am shocked by how big you're looking.
I just feel super relieved, and it's like, I just love life. I love life.
Back to normal, back to the status quo, because everything turned out good. And Amber, if you really love life, you would be trying to change it. Well, I mean, I'm not trying to sound mean. But what does this woman love about life other than she gets to sit around, be lazy, always have somebody at her beck and call doing her bidding for her? She gets to feel like a little queen in her own head. She has nothing to show for all the money she's made and stuff. Like I was saying, like, she doesn't do anything productive in her life. She doesn't have anything to show for all the money she's made. She doesn't contribute to anybody around her's happiness or life in a in a meaningful, positive way. She doesn't ever do any volunteer work. She doesn't have a successful career. She doesn't own any property or anything of value. She isn't even like just a good person. She's not a loving housewife and mother or stepmother, or, you know what I mean? It's like, I think she loves her life because, like, while a lot of us are like, man, I would never want to live like that, Amber loves being this way. She loves having no responsibilities, not having anyone to think of but herself. She doesn't care if she inconveniences other people to have to do things for her and drive her around and stuff. As long as she can sit there in her little safe space, in her little apartment, where everything is done for her, acting like a little high and mighty, I live in this fancy luxury place, I'm a queen thing, and she doesn't have to lift a finger for herself, and she can manipulate the people around her, she's happy. That a lot of us think is a very, like, unfulfilling, sad life, a selfish life, but it is exactly what Amber likes and wants.
I love life so much, and life is beautiful.
It is, Amber, but you don't do anything with it. What do you do? Where do you go? What do you see? What do you really experience other than, oh my God, I got to talk to a new Uber driver tonight. Like, you didn't get to go see any of the sights, go enjoy the places, the cities, the, attractions. You don't get to see different cultures and people, and you don't do anything. Life is beautiful. The world is beautiful. Having people in your life, your family, your friends, those relationships are beautiful. You have none of that. You're a very, I would be so depressed if I were her, because she has a very empty, meaningless life. And that's actually tragic, because, like, I know from the people in my life and having my son and knowing what I like, I wouldn't trade and have Amber's life for all the money in the world, all the money she made at her peak. I wouldn't take it.
It can be hard, but it's, like, worth it. And like I said, I thought I was going towards doom.
You are, Amber. You are going towards doom. You are actively on the track, and it's coming. You think it's not because this all turned out good. Like I say all the time, your health, your blood work, your test results, everything is good until it's not. And she's getting to a point, her body has just been able to manage to some degree for now because she was, like, younger, but she has been so obese most of her life. And now she's approaching her mid-30s, and she's, with the exception of maybe just a few months here and there, she's been maintaining on a 5'2", 5'3" frame. 500 pounds or more, most of the time much more, for over the past, like, 6 years. And I don't even think those times where she said she was below 500, she really was, or she wasn't that far below it. That will take a raging toll on your body. And it doesn't help that literally 90% of her diet has been highly processed, packaged, refined, garbage, processed food full of added bad preservatives, bad fats, bad carbs, sugar, trans fats, or takeout, highly calorically dense. So she is really just after body. I mean, that wouldn't be good, somebody eating like that who was maintaining a healthier body weight because they're active. But she has the double whammy of that's 90% of her diet forever. And she won't listen to people when they say she actually has to change that. And with the super excessive amount of weight, she's really, I don't know what it's going to be, man, but something is going to happen. I don't know for the life of me what it's going to be.
I found it was my end. During my whole uterine cancer journey, I completely disassociated. It's almost as if it didn't even happen to me as a person. So I feel like that's why like so many people, when they're like, Amberlynn, wasn't that your rock bottom? Like, what happened truly? Honestly, it's because I disassociated the whole time.
Amber, that's not how dissociating works, or disassociating, whatever you want to say. That's not how that works. Like, I'm not 100% familiar with it, but you don't dissociate for months and months and years at a time, Amber. You don't go in for a hysterectomy and then, you know, gain all your weight back and more. You don't do massive mukbangs. You don't refuse to even eat a little bit healthier or a little bit less when you're sizing out of medical equipment and imaging machinery and vehicles, because you almost don't fit into a vehicle anymore when you need an ADA apartment because of your size. Like, from what I understand, dissociating happens, and it does happen, but it doesn't. You didn't dissociate for the past like 3 or 4 years, Amber. You're just using that as a buzzword, as an excuse. It's something you heard on TikTok. No. You don't get. See, she's always looking for a freaking excuse. You don't get to use that excuse, Amber. You don't have an excuse. You willingly chose to do nothing, to not do what you needed to do, to keep eating the way you eat, to keep eating the massive amounts you eat, and to not lose any weight. So that's what really happened, but tell yourself whatever you want.
Unreal. I felt like I was in dreamland.
Okay, so if you were so dissociating and you know that that's what you were doing and you were so scared now, and this terrifies you so much now, then that means, one, well, you should have been getting therapy for years, which you need. But two, that means you're going to do the right things now, right? Because this one really scared you and you were afraid the cancer was back. So you're going to actually lose weight and stay on semaglutide or go on a diet, try to find a bariatric surgeon in Oklahoma and go through with the surgery. You're going to start eating healthier, because one of the things that pisses me off more than anything is this woman, and it's proven to be an epic fail and to be wrong. We have 10 years of proof of that just from her on YouTube. She still thinks the only freaking thing that matters in food is the calorie count. It doesn't matter if it's processed or not, if it's from a restaurant or not, if it's healthy or not, as long as the calories, and it's so much more than that. Yes, calories are important, but that is by far the most important thing. So, but she's going to get it together this time, guys, because she was really scared and she scared everybody and she thought her cancer was back. So if you were really that scared and that terrified and it bothered you that much, you'll make changes.
So a nightmare, but it just didn't feel like it was happening to me.
Oh, now this one didn't feel like it was happening to her either. This didn't happen to Amberlynn Reed. That was happening to Scamberlyn Greed or something like that. This is her trying. See this? Okay, so she's just fucking. Oh my God, I'm sorry. She's like making an excuse again already. Oh, it felt like it wasn't happening to me. So like, okay, but you're here now, Amber. You're with us. You're cognizant now. Isn't that your new word? Your new big word of the day you used? So you need to do what you need to do and make the changes, girl. Because if you don't, especially after this stunt, people are really the views are gonna start dropping off even more. And she can't afford that.
And during this whole thing of me being really scared that my cancer did come back, I had moments where I did disassociate, but for the most part, I have felt every fear. I have felt so scared and I have gone through so much regret.
Well, then you will make the changes. And if you don't, then you didn't, and nobody feels bad for you. Not in the least.
And just like thinking back to like everything I should have done after being diagnosed with cancer. And I was like, fuck, I might have really fucked up. It's like,
yeah. Oh my God. Oh my God. You don't say, Amber. People have been telling you that for years. Your haters that you think hate you so much have been telling you that, which was for your own good. Your babies have been telling you that. The people in your life have been telling you that, more or less. Doctors, nutritionists, people have been telling you that, Amber. You haven't wanted to listen because you're lazy and greedy and you're a glutton and you're selfish. And you think you know better than every single other person. You know what I mean? You can't get out of your own way.
like just feeling all those things and having this scare, like it just really puts things into perspective for me. And
good. So I'll be very excited to see the weight loss over the next couple of years. I can't wait to see you down a good 100, 125, 130 pounds by Christmas, and making healthier food and going on actual walks and moving, maybe talking to a surgeon. I can't wait to see it, Amber, because if all this is true, then this is what we're actually going to see. So yay. Can you hear my sarcasm? I mean, that is true, but she's not going to do it.
I just want to continue making positive choices.
You don't make positive choices. How about you start making positive choices? You're somehow finding a way to eat through your Ozempic. I mean, I know you're only on the smallest dose, but you're not really losing any weight.
In my life, I'm not the beacon of health. I have health problems. I'm 33.
Well, hold the press, guys. I just learned something amazing. Amberlynn is not a beacon of health. I never would have known.
Continue making positive choices in my life. I'm not the beacon of health. I have health problems. I'm 33 years old.
Which is funny because over the past year, especially while you were with Jade, you talked about how, oh, I'm big and I'm obese, but I don't have any health problems. My blood work always comes back perfect and my blood pressure is always perfect. My doctor said I was obese, but I'm completely healthy. I don't have mobility issues. I don't have legs 8 times the size they should be. No problems at all. Yeah.
And every day I just get older. I don't want to continue looking back.
I hate this old shaming too. You know, she does that. I think she says she's old. One, because she wants people to go, oh my God, Amber, no, you're not. You're so young. You don't look old. You're so beautiful. You're young and beautiful. But like, it's insulting to people like me who are like in my early 40s as a woman. And when you're that age as a woman, they act like you're like, you need to be put out the pasture, that you're like washed up and old and saggy and gross. And then that's like not true a lot of the time. I think Amber's like just keeps pushing how she's old. I'm old because she is starting to have health issues and stuff. And she's going to try to chalk it up to her weight or to her age more so than her weight, that her age has more to do with it than her weight. When no, her age has nothing to do with it. When I was her age, I had just had my baby. I had my son. I was in the prime. I was the healthiest I've ever been in my adult life, and the thinnest and the fittest. Even now with like PCOS and Lyme's disease and stuff, I don't have problems with blood pressure and stuff like that. I don't have any chronic like heart disease or anything like that. My like the problems I have are from like other factors, and then just like, well, the PCOS is just something you're born, you just end up having. But I know I can put it in remission if I lose enough weight and eat right for me. But she just keeps bringing up this age thing. One, because she's fishing for compliments, and two, because she's going to try to pass upcoming problems like kidney stones and this, that, and the other on age more so than weight. When 33, dude, is young as hell. It is young as hell.
Back saying I should have done that. I should have changed then.
Well, you should have, Amber. And you keep getting more and more chances. Everybody keeps telling you can still change. Now, there is irreparable damage done. I am 100% sure. But she could still change. and get a few more years out of life. But then there's the whole factor of that's a lot of work and she doesn't want to do it. And that's a lot of like self-discipline and deprivation. And she doesn't want to do that, and being hungry, and she doesn't want to do that. And there's also the factor of she is, amazingly, for being her size, super shallow and arrogant and obsessed with her appearance. And she does not want to have all the sagging skin. Part of it, she thinks it looks deflated. She thinks it looks gross. And the one thing she really hates is, because she has this thing with aging, she likes to date younger girls. She's like stunted, so she thinks she acts younger, is the sagging skin makes people look older. You know, and it's okay because they still look great. And you can always, you know, eventually get it removed, even if you just get like your arms and like a facelift or whatever. But she doesn't want to have that sagging skin and look old and deflated in the meantime. It is a completely shallow ego thing that she will not get past.
So there's really only one thing I can do moving forward, and that is just be better. So I'm going to
be better. Lose weight, Amber.
Bingo with my mom, and instead of getting a large Diet Coke as much as I want to, I'm gonna get a water.
See, and that right there, she's like, oh, as much as I want to. Amber can only say no to herself for a very short amount of time. This is for the camera. I guarantee she has a Coke at her house.
There's tons of water options. I'm like, which one do I want? All right, I think I'm gonna get this guy right here. Pure water. There's this store next to the bingo place, and my mom's looking at it through the window because it's closed. Someone made their cat out of rocks, and it says, "My cat rocks." Get it?
We're at bingo again. Amber, why don't, instead of going to bingo, like, let your mom and her boyfriend go to bingo themselves and actually have a date and some time to themselves and say, hey, Mom, how about, you know, instead of me going to bingo with you tonight, you can go with your boyfriend and actually have some time with him as a couple. Why don't you meet me like an hour before you go to bingo, and you and I can walk around my apartment complex. We'll go for a little walk. That way it'll be easy. You'll be close to home. And you'll get some exercise. No, God forbid we do anything that doesn't require sitting.
So I'm currently outside with Twinkie, but I just want to let you know that I won at bingo 3 times.
Well, Amber, that's no reason to be freaking cocky and arrogant. It happens. People can win all the time at bingo.
I literally have no
she's so smug, and then she wonders why people don't like her.
idea how it happened, but it did. Sometimes I get lucky and I'll win multiple
You get lucky, Amber. You don't know how lucky you get in so many freaking ways.
times a night, but then I won't win for months. It doesn't make sense. So I want to give just a little bit of an update on Semaglutide and how I'm doing on it. So tomorrow is actually
I mean, I don't how far behind do you think these videos are? I think she's probably quit it already, or is like on the verge of quitting it. Once it really kicks in and she can't eat, she's gonna quit.
A little bit of an update on Semaglutide and how I'm doing on it. So tomorrow is actually going to be my 3rd shot, and so far it's doing the job. But I also, like I've said, I've been sober, so I no longer have those like munchies.
So it's all her willpower, guys. It's really not the medicine doing it. It's Amber's willpower. She's doing this herself. Realistically, she probably needs to up the dose soon, because the lowest, she's only on like what? She's on the lowest dose, and it's not going to work for somebody like her very long.
Bothering me every single day and night. What I've noticed since being sober and also taking Semaglutide, I'm able to have things like this. You guys saw me.
Yeah, and why do you have that shit in your house, Amber? This is what I'm talking about. You bought that in the middle of all this. My cancer might be back scare. I'm so terrified, guys. You wouldn't have bought that if you were actually truly scared. And it was like scaring you straight, you know, like as far as your health. But here you go. You have these. And I'm guessing, because Amber likes to buy things in multiples. You know, she can't have just one of anything. I'm guessing that this is a second bag of these bad boys that she didn't haul when she did her Trader Joe's video, because she wouldn't show it because people were freaking out about one bag. You'd think they'd lose their shit over two. So she probably already ate the first bag. There's no way this is the original bag. This is a second bag. And keep note, it's open.
when I hauled this. They are sour cream and onion corn puffs, and I love them. They're so good. But
yeah, you love them, and that's why you shouldn't have them in your freaking house, Amber, because you talk this talk every few months about you're so good, you have so much self-control, suddenly you have your eating under control, and then the weight loss talk, the diet talk starts to fade, and then people go, oh, you haven't said anything, and then in a few weeks later, she does a video that says, oh, I haven't really been talking about my weight and stuff, but I'm gonna do a weigh-in soon. Your girl's not been on track. I haven't been doing the best, and I've been slipping up, and those things from Trader Joe's triggered me. So it's like it's the same routine over and over. You could set your clock to it.
Able to enjoy a few and then move on.
There's no way, Amber, that you can just enjoy a few and move on. If that was the case, you would be losing more visible weight, because you could lose that much weight easily without the semaglutide. And if you're on it, then it should be even more.
Is not consuming my mind anymore.
All of a sudden, guys, she has this great relationship with food. The food noise is gone. She's not thinking about food, and it doesn't bug her. She said this she said this when she was trying to get wifey back, during that time when she was so on track and everything, she had it together, when she was doing the mustard cottage cheese thing before she left Kentucky. And then she was saying that a few weeks ago, and then she was saying that during the weight loss surgery arc, and then like I said, a month or two later she comes back, oh, I wasn't doing good, I was way bad. So I don't believe it. I won't believe it until I see this woman actually physically shrinking.
I no longer have food noise. No, things aren't perfect. I would say Wednesday I was the hungriest. I don't really know.
Holy shit. Did you hear that? Wednesday, I was the hungriest. Oh my God. Amber, learn how to freaking talk. I mean, I understand mispronouncing things, but holy shit. Hungry? I thought she was actually going to freaking honk. I thought she was mimicking a goose. Honk, honk. Nope. Sorry, guys. I was just hungry. Oh my God, Amber. Come on, girl. It's a simple word.
What that was about. It wasn't physical hunger. It was a lot of head hunger. So the food noise does disappear. Sometimes it sneaks its little head in there.
Yeah, and that's why when you have stuff like that, you should, because of those problems, I know because I deal with that, you shouldn't have stuff like this in your house. Especially when you have nobody at your house to keep you accountable. You're going to go and eat what you want. I mean, Crystal's parents had to lock you out of the kitchen. And that was 10 years ago. So look at how much worse you are now.
But thankfully, I get fuller faster now. It's just, I feel great. Honestly, I feel great. This is the very same bag that I hauled. And if it...
No, it's not. That's the second bag. I don't believe for 1 minute that's the same bag. It's not.
Wasn't for the semaglutide, if it wasn't for me being sober, this bag would have been gone.
And also, this treat, this snack is just all processed carbs and sodium and preservatives. If your mindset is so much better and you're snacking, why didn't you get rid of that, not buy that, and just buy some more peppers or celery or carrots or broccoli that you love so freaking much? Get a healthier snack, Amber.
Night 2. It's just little changes like that. I'm just okay, I'm feeling good.
Oh, have to drink that water on camera to show us that she's drinking it.
Cold water. I slept on it for a long time. All right, you guys.
Oh, and now cold water, guys. Just plain cold water is just, she loves it. She's such a healthy girly. Oh my God, nothing does it for her. Just water. Yeah, right. That was the only water she drank that day.
So it is that time where it's the end of my vlog. So we're going to do some questions of the day.
I don't even want to listen to these things because she's been really kind of short and smug in these things.
Not hungry, then why are you eating, girl? I can't. So I think they're talking about this clip. All right, you guys, I currently have some chicken in the air fryer, and now I'm just
pat out the video.
Just gonna come up with some concoction to go on the side. I'm currently not really hungry, so I was told though that I do need to eat. So I haven't ate all day. I've been awake for hours.
Eating.
At least 6 hours. So when you're on semaglutide, sometimes you literally are not hungry. You have to force yourself to eat.
No, you don't, Amber. Are you underweight? Are you borderline underweight? No? You don't need to eat.
And I was told by the person who prescribes me semaglutide that I need to eat. I need to get in my...
That person hates you, Amber. You don't need to eat. Because, Amber, you could fast for weeks and weeks and weeks and months. And as long as, I said that in my last video, I think, as long as you were taking electrolytes and a vitamin, you would be fine. Yes, you need protein and stuff. Have some like protein shakes or something. You don't need to eat. Like, I know people are like, that's wrong to tell someone they don't need to eat. No, if you are not hungry, don't eat. If you go it's okay. Like, oh my God, I know I'm about to say something controversial. It's okay to go a whole day even without eating or not eating much. For Amber, that's probably healthier. She's not a diagnosed diabetic as of yet. She has tons of excess weight. Her insulin and blood sugars are chronically elevated. It's not going to hurt. It's actually going to do her good to not eat.
Protein. I need to get in my veggies. I know that
you don't necessarily need to get in your veggies, Amber. I know that's another hot take, but the one thing you need is protein. So you could have a few protein shakes. Drink like 2 or 3 protein shakes a day, you know, instead of your diet soda. Drink your water, your protein shakes, just like they do before or after bariatric surgery. You'd be fine.
That I am over 400 pounds, but there are nutrients that I do need in my body. Would the Ozempic be worsening whatever was happening with your health before you started taking it? No, there has been no correlation whatsoever. Are we not?
But there will be something coming up that is an excuse to quit. So she'll go, you know, I didn't want to share this with you guys. I wasn't telling you what was going on, but, and there will be a reason she quits.
I'm going to talk about the fact that the camera for weigh-ins is always in the same spot every time. Yes, that's because I put my camera in the same spot every single time.
Because you're faking them. We told you various things you need to do to make your weigh-ins believable. So until you keep doing that, like I said, I'm going to keep adding like 30 to 50 pounds minimum to every freaking weigh-in.
Who is Valentine? Valentine is my girlfriend.
And she lives rent-free in my head. I don't believe she has a girlfriend. And if she does, this person clearly is not that serious about her or has real reservations because she hasn't moved in with Amber yet.
Is it true that you just had precancerous cells?
She's embarrassed of you, Amber.
Also not actually cancer. I was diagnosed with actual cancer.
Now, I did hear that she did backtrack and say she had precancerous cells. But if her post-op paperwork that's on the farms was hers and was accurate, she did have cancer. And actually, it was a little more advanced than I initially thought, because if it was either the stage or the grade, or maybe a combination of both. But it was a little further along than uterine cancer is found in a lot of women. So she is lucky she caught it when she did. But I wasn't around during the cancer era, so I would have to kind of go back and see these things and hear what they're talking about. I personally give her the benefit of doubt that she did have it. But I don't know. That's very controversial.
Technical term for it is endometrial adenocarcinoma. I was at stage 1, grade 2. So it's cancer in the womb, which is uterine cancer. That is what I had and what I was diagnosed with. I had a stage, a grade. So what was happening was my cancer was traveling so far into the uterine wall that it was going into my muscles.
So see, her cancer was actually progressing because she let it go for a couple of years. So that's why it was even more important for her to go and lose the weight and get that PET scan and get her follow-up scans, because all it takes is a couple cells to go and start doing their thing, and it'll come back. I just can't believe she didn't get those follow-ups. Like, seriously, if that doesn't make you lose weight to be able to fit in that machine to get that very important test, nothing's going to. We're gonna see Amber die between, I'd say, 520 and 650 pounds.
It was not precancerous, it was actual cancer. So that's very much the reason why I've been having a lot of anxiety.
And like I said, you don't get to use that as an excuse, Amber, because you didn't do jack shit to change anything. So you can't say how scared you are and then not change anything. People who are truly scared make at least some changes. You did nothing. In fact, you got worse.
Around the fact that my cancer could have spread, and thankfully it did not. This is unfortunately something
You don't know that though, Amber. You still truly don't know that. You really need an MRI or a PET scan to be 100% sure, I would say.
that I'm gonna have to deal with for the rest of my life. Anyone can get cancer, but someone who has had cancer before.
And so that also means you're going to be going up to you're going to get an oncologist and follow up with them, right? Yeah, right.
It's easier for it to happen again. Anyways, I'm going to end this video. I hope that
I didn't like it, Amber, but anyways, let me know what you think about all this stuff. Were you surprised about those CT results? If she were to bait something like this again, would you still watch? Would you be less inclined to watch or believe her? I feel like her doing stuff like this like really damages what little credibility she has left with people. But yeah, so like, subscribe, do all the YouTube things. I will post this and get this out for you, and then I will see you guys in the next video, which will be coming up soon.